Most women will experience labour starting naturally between 37 and 42 weeks. And what this means is that the uterus surrounding your baby will start to tighten and contract to push baby down lower into your pelvis. And the bottom of your uterus, called your cervix, will start to soften and open to allow your baby to be born. Many women are offered induction of labour, and this is for a variety of reasons, which your healthcare professional will talk to you about the time if that's something that they are recommending to you. But induction of labour means that your labour will be started artificially through giving you medications to start those contractions in the uterus and to soften and open the cervix. When you are discussing induction of labour with your healthcare professional, it's good to be aware that you don't need to make a decision there and then. You can go away and think about it. You can do some research. If you need some time to process what they've told you, then this is perfectly acceptable. And you can, simply say that you want some time to think about it, and that you will let them know what your decision is, or you will contact them further if you want to discuss any more. If you do choose induction of labour, then here are some things that you might expect. So when you're booked in for induction, you'll be given a date. And what this means is that you'll be contacted on that date by somebody at the hospital who will tell you when to come in to the hospital for your induction. Sometimes if the unit is busy and there aren't any beds available, then your induction may be postponed to another day. Or when you arrive at the hospital, equally, if the unit is busy, then you may have a long wait before your induction of labour starts. So it's good to bring in some books or anything that can occupy your time. Some people download movies on an iPad or a phone, and these can help the time go a little bit quicker. So it's important to know that the date you are given isn't always the date that you will come into hospital. Equally, the date for induction isn't always the date that you will have your baby or give birth. Sometimes induction of labour can take a long time, and especially for first-time babies or first pregnancies, labour can take up to a few days, at least 3 days. So it is important to understand that the date of induction isn't the date that you will give birth. So it's important during this time when you're in hospital to rest and sleep when you can, eat and drink, and conserve your energy for labour, and take walks when you can. But it's important to try and occupy yourself as much as you can, because you need your energy for when labour happens. So when you first go into the hospital for your induction, they will offer you some monitoring of your baby's heartbeat, and they will ask you about your movements. And this is just to determine how well your baby is before the induction process starts. You will then be offered a vaginal examination to assess the cervix and to see if there's been any changes already. And there is another video about vaginal examinations if you want to hear more about these in depth. This is your first baby. You might then be offered a medication called Propess, which is a small tampon that is inserted into your vagina by the midwife, and it sits behind the cervix. And what that does is it sits there for up to 24 hours, and it softens the cervix. It releases a hormone called prostaglandin. It softens the cervix and hopefully starts it opening. If this is not your first baby, you may be offered a balloon catheter induction, and this is for women whose cervix is already open a little bit, and a small plastic tube is inserted into the vagina, into the cervix, and on the end of that tube is a balloon. That balloon is slightly inflated and it sits inside the cervix, and it opens the cervix and just stretches them. And the idea is that your cervix will then release its own prostaglandins to help it soften and open, ready for labour. During this 24 hours of a balloon induction, or pro-pes induction, your baby will be monitored frequently. They will monitor the heartbeat and the movements, and you will also have observations done yourself. So somebody will check your blood pressure and your temperature and your pulse at least every 4 hours. If after the 24 hours labour hasn't started, then you will be offered another vaginal examination. And the purpose of this is to see if there's been any further changes. If there hasn't, then another hormone tablet will be inserted into your vagina behind your cervix. And this is called a prostin tablet. And that sits there for 6 hours before you are reassessed. And in some units you can have 2 or 3 of these prostin tablets, but it will depend on your own individual circumstances as to how many doses you will receive. When your cervix is soft and it's opening, you will then be offered an ARM, which is artificial rupture of membranes, which involves the midwife inserting a plastic tube into your vagina, goes through the cervix and reaches the bag of water that your baby is surrounded by. And on the end of this plastic tube is a little hook, and the midwife will pierce a small hole into the amniotic sac, and what that will do is release the amniotic fluid surrounding baby. Following this, you will have some monitoring of your baby again, and then you'll be asked to perhaps go for a walk or to sit upright. And the idea of this is that your baby will be stimulated to come down into your pelvis further and hopefully soften your cervix and start contractions. If so far labour hasn't started, the next step is a hormone drip called oxytocin, and this involves inserting a cannula into the back of your hand or your wrist. It's a clear plastic tube that is attached to a bag of hormone drip, and this hormone is dripped very slowly into your vein, and the idea is that it will stimulate your uterus to start contracting. You can stay on this hormone drip for quite some time, and quite often most women will reach this stage of induction, and you can ask for pain relief at any time during this process. So sometimes women will feel pain right in the early stages, and you can definitely ask for pain relief, or you can take a walk or have a warm bath or anything that will help relieve the pain for you. If the oxytocin drip doesn't produce labour and your baby has not been born, then your consultant might talk to you then about having a cesarean section if all other methods of induction have failed. But this will depend on your personal circumstances and how well your baby has been managing through the induction process as well. You can talk to your midwife about induction anytime. Thank you.